That thick yellow toenail that's been embarrassing you for months or even years. It's time to finally get rid of it for good. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. The truth is, most people struggling with toenail fungus are using treatments that simply don't work, or they're making critical mistakes that keep the infection coming back. What's even more frustrating is that many of the products marketed for toenail fungus have success rates of less than 10%. In today's video, I'm going to show you the treatments that actually work, why most over-the-counter remedies fail, and the exact approach I use in my practice to eliminate stubborn toenail fungus. You'll learn about prescription medication, laser therapy, and the combination treatments that give you the best chance of success. Please take a moment to hit the like button and subscribe to the channel with the notification bell. This helps others with toenail fungus find this crucial information, and I post new videos every week with important foot health content. Also, I wrote a book all about toenail health, and I'm happy to send it to anyone who requests it. The URL to request my book is www.mytoenailbook.com. Most people think that toenail fungus is just a cosmetic problem, but it's actually a persistent infection that can spread to other nails and even to your skin. The fungus that causes these infections is incredibly resilient and has evolved to survive in the exact environment your toenails provide: dark, warm, and moist. What makes toenail fungus so difficult to treat is that it lives underneath your nail, protected from most topical treatments. Your nail acts like a shield, preventing medications from reaching the infection. This is why so many over-the-counter treatments fail to provide lasting results. The frustration I see in my office is real. Patients come to me after trying countless remedies that they found online or bought at a pharmacy. They've spent hundreds of dollars and months of their time only to see minimal improvement or complete failure. The infection often comes back stronger than before. Understanding what you're really dealing with is the first step towards successful treatment. Toenail fungus isn't just a surface problem that you can scrub away. It's a deep infection that requires targeted treatment to eliminate completely. Why most treatments fail comes down to several critical factors that most people don't understand. The biggest issue is the topical treatments simply can't penetrate thick infected nails effectively. Even when they do reach the infection, the concentration is often too low to kill the fungus completely. Poor penetration through thick nails is the primary reason over-the-counter treatments have such low success rate. Your nail acts like a barrier, preventing antifungal medication from reaching the infection underneath. This is especially true for nails that have become thick and discolored from chronic infection. Inadequate treatment duration is another major factor. Many people stop treatment as soon as they see improvement, but the fungus can still be present even when symptoms seem to be resolving. Stopping treatment too early allows the infection to return, often worse than before. Not addressing the root cause means that even if treatment temporarily clears the infection, it's likely to return. Factors like poor foot hygiene, wearing the same shoes daily, or having a compromised immune system can all contribute to recurring infections. Inconsistent application of treatment is surprisingly common. Many topical treatments require daily application for months, and missing applications can significantly reduce effectiveness. The fungus takes advantage of any gaps in treatment to regrow and spread. What actually works for toenail fungus involves understanding that different treatments work better for different people at different stages of the infection. The most effective approach often combines multiple treatment modalities for maximum success. Prescription oral medications represent the gold standard for treating toenail fungus. These medications work from the inside out, reaching the infection through your bloodstream rather than trying to penetrate through the nail. The most commonly prescribed oral antifungals include terbinafine and itraconazole. Terbinafine, also known as Lamisil, is typically taken for 12 weeks for toenail infections. It has a success rate of approximately 70 to 80% for completely clearing the infection. The medication concentrates in your nail tissue and continues working even after you stop taking it. Itraconazole or Sporanox can be taken daily or in pulse doses. Pulse dosing involves taking the medication for 1 week per month for several months. The approach can be easier on your system while still providing effective treatment. The main concern with oral antifungals is potential liver toxicity, which is why blood tests are required before starting the treatment. However, serious liver problems are rare, occurring in less than 1% of patients taking the medication. Prescription topical treatments are more effective than over-the-counter options because they contain higher concentrations of active ingredients and are formulated to penetrate nails better. Cyclopirox nail lacquer and efinaconazole solution are two FDA-approved topical treatments. Cyclopirox nail lacquer is applied like nail polish and builds up layers over time. It has antifungal properties and helps to remove infected nail material. Treatment typically continues for 48 weeks, with success rates around 30 to 40% for a complete cure. Efinaconazole solution, marketed as Jublia, is a newer topical treatment with better nail penetration properties. It's also applied daily for 48 weeks and has shown a higher success rate than cyclopirox. Laser therapy has emerged as a promising treatment option that works by heating the nail and underlying tissue to temperatures that kill fungus while leaving healthy tissue unharmed. Several different nail laser systems are available, each with slightly different approaches. In my experience, laser therapy for toenail fungus has been a disappointment. I returned my laser when I saw it wasn't providing adequate and reliable results. It's expensive, not covered by insurance, and just doesn't consistently work. What about surgically removing the diseased nail? Does it grow back free of fungus? The answer is usually not. In fact, removing the toenail is traumatic and can cause the nail to return thicker, even without fungus. I've also found that despite treating the nail bed topically, the fungus often returns about 50% of the time. Unless the toenail is painful, I don't recommend removing the nail surgically. Nail debridement, or professional trimming or thinning of the affected nails, can significantly improve the effectiveness of any treatment. By removing as much infected nail material as possible, medications can reach the remaining infection more easily. This procedure is typically performed in the office using specialized instruments to safely remove infected nail tissue. Regular debridement throughout treatment helps monitor progress and ensure that medications can penetrate effectively. The role of proper diagnosis cannot be overstated in successful treatment. Not all thick, discolored nails are caused by fungus. Conditions like psoriasis, trauma, or bacterial infections can cause similar symptoms but require completely different treatments. Laboratory testing involves taking a small sample of affected nail and either examining it under a microscope or sending it to a lab for culture. This testing confirms the presence of fungus and can identify the specific type, which helps to guide treatment selection. Skipping proper diagnosis leads many people to treat conditions that aren't really fungus infections, which explains why the treatments fail. Getting an accurate diagnosis before starting treatment is essential for success. Prevention strategies are crucial for avoiding reinfection once treatment is successful. The same conditions that allow the initial infection to develop can easily lead to reinfection if not addressed properly. Proper foot hygiene involves keeping the feet clean and dry, changing socks daily, and using antifungal powder in shoes. Pay special attention to drying between toes, as moisture trapped in these areas provide ideal conditions for fungal growth. Shoe rotation and care includes having multiple pairs of shoes and rotating them daily to allow complete drying between uses. Using antifungal sprays in shoes, replacing old contaminated footwear, can help to prevent reinfection. Environmental precautions include wearing protective footwear in public areas like pools, gyms, and locker rooms. These environments are common sources of fungal infections, so protection is essential for prevention. What to expect during treatment varies depending on the approach chosen, but patience is essential regarding the method. Toenail fungus treatment is measured in months, not weeks, and visible improvements often don't appear until healthy nail begins to grow out. Timelines for improvement typically begin with stopping the progression of the infection, followed by gradual improvement in nail appearance as the healthy nail grows in to replace the infected tissue. Complete nail regrowth can take 12 to 18 months for toenails. Monitoring progress involves regular follow-up appointments to assess treatment response and make adjustments as needed. Your podiatrist will track changes in nail appearance and may repeat laboratory testing to confirm that the infection is clearing. Managing expectations is important because even successful treatment might not result in nails that look exactly like they did before the infection. Some permanent changes in nail thickness or appearance may persist even after the infection is eliminated. When to seek professional help should be sooner rather than later. Early treatment is more effective and requires less aggressive intervention than treating chronic severe infections. Signs you need professional treatment include thick, discolored nails that haven't responded to over-the-counter treatments, spreading infections to multiple nails, or any sign of secondary bacterial infection like increased redness, warmth, or drainage. The evaluation process includes examining your nail, discussing your symptoms with previous treatments, and often taking samples for laboratory testing. The comprehensive assessment helps to determine the best treatment options for your specific situations. Treatment planning takes into account factors like the severity of infection, your overall health, the medications you're taking, and your preference regarding your treatment options. The goal is to develop a plan that maximizes your chance of success while minimizing risk and side effects. The key to successful toenail fungus treatment is working with a podiatrist who understands the various treatment options and can develop a personalized approach based on your specific situation. Don't continue struggling with ineffective treatments when proven solutions are available. If you found this information helpful, please share this video on social media. Your simple share could help someone finally get rid of their stubborn toenail fungus. Also, leave a comment below if you have any questions about toenail fungus treatment. I do my best to respond. Also, don't forget to get your free copy of my toenail health book at www.mytoenailbook.com. It contains detailed information about everything we've discussed today, plus additional prevention strategies and treatment options. If you're struggling with toenail fungus that hasn't responded to over-the-counter treatments, don't wait any longer to get professional help. Schedule an appointment for proper diagnosis and treatment planning. We can evaluate your specific situation and develop a treatment plan that gives you the best chance of finally eliminating your toenail fungus for good. The link to schedule is in the description below. Thanks so much for watching, and have a great day.